Welcome to the second module in the Surviving and Thriving as a New Leader series. We hope that since the first module, you've had some valuable conversations with your colleagues and others about what it means to be a leader in your organization. In this module, we're going to take a broad look at your healthcare organization and help you think about how you and your team contribute to its long-term success. We'll also explore the ways you impact culture and relationships through your daily interactions with others. And just like in the last module, you'll hear from other leaders and providers who will share their perspectives on these topics, and we'll leave you with a few things to explore and pay attention to between now and the next module. So let's get started. As a leader of your team, you're also part of the broader organization's leadership team. The most effective leaders understand that every decision they make throughout the workday impacts not only their team's relationships, work environment, and ability to meet goals, but also the culture and long-term success of the organization.
The leader is that person that everybody looks to. You're always up front. You're always in this, it's almost like a fish in an aquarium. You've got glass all around you. People are always looking at you. People are always noticing what you do. So you need to be able to do that as best you can without being detrimental to the organization or someone else. As a leader and a manager, you have to really be able to understand where you are and what your expectations are. The organization is, to me, I consider it like a pie. And you have your piece of that, but you're still a part of the whole. So leaders have to be able to understand, although this is my department, I need to be able to understand, if I'm nursing, I need to understand radiology, how nursing fits into the picture with environmental services, how everything has to work with plant ops. And so I have to have a broad understanding, not just of nursing and what I expect a nurse to do, but to understand how we fit in this big picture. So I expect my leaders to know the people they're working with, to have a relationship with them. You have to know somebody and understand that person and understand yourself, I think, in order to be the leader that you can be.
Thinking about the big picture, let's talk about culture. Culture is sometimes described as the personality of an organization. It encompasses shared values, beliefs, and assumptions, and influences the way that people interact with each other, make decisions, and solve problems at work. It's how we do things around here. If after Module 1 of this series you completed the leadership style assessment and read the accompanying article, you know about the connection between leadership style and culture. Leaders positively impact culture when they use a leadership style that fits a given situation, but can negatively impact culture when their style doesn't fit the situation. We'll come back to explore this idea in more detail a few times in this series, so if you haven't yet completed the assessment, see the link in the resource guide for this module. Diversity, equity, and inclusion impact an organization on many levels, and culture is the place where it all starts. After all, if culture embodies what an organization values, the only way to ensure that systems, processes, and practices support DE&I is to build a culture that places a high value on it.
I think this RAS, building inclusivity, is part of that trust and culture environment. If you want people to feel like the organization represents what they believe in, then you have to build that culture. And as I said previously, building culture it's not a destination point, it's a journey that you have to work on throughout. It's not bringing in a consultant and doing some culture exercises. This is a real commitment to standing foundationally on the beliefs that your organization has, whether it's in healthcare or anything else, and then expressing that culture belief in everything you do. That means that employees have to trust each other They have to trust you as a leader, and that trust will permeate into the folks, the patients that you serve. I guess I really want to put a heavy emphasis on building that culture, because it becomes the foundation that you work from. And if you're just kind of expressing a mission, but the folks that work with you in your organization don't believe that mission, or they see inconsistencies in how some patients are treated versus other patients, it will have a negative impact and really prevent you from accomplishing your mission. You can't start adding on health equity and inclusivity until you have established within your organization that strong culture.
Earlier, we said that as part of the organization's leadership team, the decisions you make impact not only the organization's culture, but also the long-term success of the organization. In your leadership role, whether you're a frontline, mid-level, or senior leader, you're responsible for ensuring that your team fulfills its expected contribution to the organization's strategic goals. In order to do this, that means, of course, that you must fully understand your hospital or clinic's strategic goals and know specifically how your team contributes to them. For example, the changing healthcare environment has led many hospitals and clinics to move away from a focus on high volume, where more procedures mean more money, to a value-based approach that rewards healthcare providers for quality and efficiency rather than quantity. Imagine you're the manager of a clinic that offers primary and specialty care. If you were doing this job 10 years ago, your focus may have been to maximize the number of patient visits and procedures in order to maximize revenue. But if in recent years the clinic's strategic plan has involved moving toward the new value-based care models, your focus would likely need to change. In these new value models, the emphasis is on wellness, chronic illness management, and to the extent possible, reducing the number of unnecessary procedures. Without understanding the shift in strategy and the reasons behind it, you'll have a harder time making decisions that will contribute to your organization's strategic success. If you don't feel like you know as much about your organization's strategic goals as you'd like to, don't worry. At the end of this module, we'll share some recommendations and resources to help you with this. And even better, our next interviewee has some guidance to share with you as well.
The best way to learn about anything, whether it's strategic goals or the healthcare environment, is to ask questions. I came in with very little medical background and definitely had not been involved since COVID hit, which I think is when I started right after COVID hit. So healthcare is constantly changing. So I asked a lot of questions. If I was too embarrassed to ask a question, I Googled a lot of things, or I would have private conversations outside of meetings to get clarification on things. I signed up for tons of webinars, whether like from leadership to how to deal with COVID, to how to support your staff during COVID. What is rural healthcare? What is a rural health clinic? Anything and everything I could find. I tried to watch a webinar, listen to a podcast, and if I couldn't give 100% of my focus to that, like watching a webinar, then I would have it on in the background, because you can still pick up on things. And then if I needed clarification past that, then I would Google or do research on the website or ask someone.
As part of building your organizational awareness, it's important to build relationships across the organization. If you've lived in your community for a long time or worked at the same hospital or clinic for a long time, you likely feel like you know many people pretty well already. But we encourage you to find opportunities to get to know more about the priorities and challenges faced by those you might already know, and to reach out to those you may not know very well. The most effective leaders work across boundaries like departments, functions, and leadership levels to strengthen relationships and build understanding across the entire leadership team.
So I guess first and foremost, I would say if you are new to clinical leadership or new to hospital leadership or new to doing it in the rural practice, welcome. It's so exciting, and it is the most rapidly changing face of medicine. So don't give up. Don't get beaten up. Don't get overwhelmed with all of the, all of the shorthand and all the letters and all the extra stuff that goes along with it. It is so important. But talk to people, build a relationship, communicate as if we are all human and we are all working towards the same goal. Follow your providers for a day. Spend one day with each one of your providers, or a couple of hours with each one of your providers, and see what their day-to-day job is. Get there at 6:30 in the morning if they get there early, or stay until 6:30 at night if they stay late, and watch what they do outside of in the rooms with the patient. So that way you know what the process are. And then if you know that you need to make a change, and if you see a process problem, you have walked through that process problem with your provider. And so they don't feel like they don't feel attacked, like they're doing their job wrong. They feel collaborated with, like, hey, Erin, I noticed it takes you an extra 4 or 5 minutes at the end of every visit to send those prescriptions. Is that an internet speed issue? Is that a problem with the computer system? Instead of going, hey, come on, you're going real slow. Why are these prescriptions not getting sent? I got patients calling over and over again. And it's like, oh, you don't have great Wi-Fi speed out here in the middle of nowhere, Texas. We might need to call and see if we can crank that speed up. So again, working through what each step is in the process to ultimately make a solution for everybody.
As you work to increase your organizational awareness, one of the most important people for you to understand is the person you report to. We encourage you to initiate conversations with your manager to learn more about their top priorities, the expectations their manager has for them, and the challenges they are currently facing. And then work to support your manager in the things that are important to them. Multiple benefits can result, such as a stronger relationship between you and your manager when you understand their challenges and priorities, clearer communication between you and your manager when you can connect your ideas to your manager's priorities, more clarity for you about the organization's priorities and reasons behind decisions. And lastly, if you're interested in growing into a more senior leadership role, proactively developing your own knowledge in this way can help you prepare for the next step in your career. Before we end our discussion about relationships, let's talk specifically about relationships between hospital and clinic leaders and medical staff. The relationship between administrative leaders and medical staff is sometimes stereotyped as being at odds, with providers focused on patient care at all costs, and hospital and clinic leaders focused primarily on the financial bottom line and the community as a whole. While this stereotype might be a bit of an exaggeration, it's not unusual for there to be some tension between medical staff and administrative leaders. We'll talk more about conflict strategies in Module 4 of this series, but for now we'll focus on our strategies for strengthening relationships. While it has always been important for medical staff and administrative leaders to build trusting, collaborative relationships, it's even more important now in a value-based environment. Achieving whole person health is a complex endeavor, and complex problems can only be solved when they're tackled by a passionate group with diverse perspectives, a wide variety of expertise, and relationships built on mutual trust and respect.
If there is an issue, there are times when instead of going to them and saying, we have a problem, I'll go to them and say, I need you to help me with something. There's some things that happen that I need some information on. So I let them provide it instead of going and saying, well, you know, this happened last night and so-and-so reported this. You just go to them with an understanding that I have one side of the story. I want to get their side. So, saying, I need you to help me with this. I need to know what happened. Can you explain some things that occurred? Without going and saying, I've got this huge problem. As a young leader, people understand that you're young. And believe it or not, they'll be very tolerant as long as you're humble, as long as you make them realize, I'm trying to be a part. I'm not standing over you. I'm not on a pedestal looking down at you. I want to be a part of this team.
But if you understand the intricacies of each person's role and you're willing to step in and assist those people with their role, maybe make their job a little bit easier or maybe streamline things, I think that that is huge. So as a new administrator, we all come in guns a-blazing and we're ready to change the world and we're going to make this place awesome and we're going to turn the whole ship around in 30 seconds. But then we're very quickly hit with the brick wall of no, you're not. Because whether you're like us and you're a 12-man crew or you're moving into a bigger hospital that's still rural and you've got 150, 200, 300 staff members as a leader, you have to know each person on a personal basis and each role on an individual basis, because I might be a provider and we might have another provider, but we might do things very differently. And so coming in as a new administrator, learn about what each person's goal is. Ask them, what's your 1-year plan? What's your 5-year plan? What's your 10-year plan? Because if you ask me, I'm a younger provider. I'm going to be around. I'm going to be in medicine for 30 more years, right? But if you ask our other provider, she's in her 60s. Her 5-year plan is partial retirement. So how can I facilitate all those patients and all that knowledge that those seasoned long-term rural providers have? How can I use them to teach my new providers? And then how can I facilitate the goals of my new provider and the goals of my end of career provider? And those are huge because that's important for all of your staff. Otherwise, you don't keep them for long enough, and retention is so incredibly important.
We had our receptionist from one clinic leave and I didn't have anyone else to step in. So I stepped in because that was the choice we had. And so it showed them that I'm not scared of like the hard, dirty work, and I'm not too good for work like that. Like, yes, I had other stuff to be doing, but that was the most important for the success of the clinic. And so I stepped in and did reception for 3 or 4 weeks until I was able to hire somebody that helped me build relationships with the nurses, seeing more of what they do behind the scenes, the paperwork that is needed right now with immunizations and different systems for immunizations and how we schedule chronic patients and how a sick patient can fit in here or there. So I think being vulnerable and open and communicating with your staff helps build the best relationships, no matter what level they're at, whether it's medical staff, providers, or other leadership.
I am so excited to share how we ended up with our administrator for our facility. Is we were selected for the RIPT project, which is the Rural Health Provider Transition Project. And that was 3 facilities in the entire United States were selected to participate. And it was myself, a provider, and my mom, who is our other provider in our separate facility, trying to do that and take care of patient care. And we realized, oh my goodness, we cannot be the administrators of both of these facilities and take care of the day-to-day operations and see the number of patients we need to see to provide care. And so we hired an administrator, which is how we ended up with Kelsey, who is just incredible. But that was the biggest collaborative effort. So I think that one of the really big projects that we undertook once Kelsey came on board was we were looking at the process of the day-to-day, how we walk a patient through the building and living that experience, because a lot of times we kind of get bogged down into the day-to-day of I'm the provider, I got to get in the room, I got to write the prescription, I got to look at the lab results, I got to get you out of the room, I got to get to the next person, right? And so sometimes it becomes monotonous and you continue to just kind of run through a cycle of, it's a recycled script almost. You keep saying the same things over and over again because you're treating the same stuff, just in a different way on different people. And so Kelsey helped all of us to step back and realize, like, my receptionist, my nurse, my scribe, myself, my referrals coordinator, every single one of us play a huge role in that patient having trust and having a comfortable relationship with us in our facility. And so I think that was such a great thing because I got to step back and just be the provider and to just really settle into that comfortable relationship with my patients, knowing that she built that relationship up with all of my other staff before that patient ever got to me. So that experience was already so positive that I just got to roll it out the door.
We've reached the end of this module. In the next module in this series, we'll help you incorporate what you know about strategic goals and your team's contribution into daily conversations with your team, and work to align your team's focus and activities with strategic goals. We'll also share strategies for giving and receiving feedback and recognizing others for the contributions they make. Before then, however, here are a few questions for you to reflect on or discuss with colleagues to help you think through how the information covered in this module applies to you and your team. How would you describe your organization's culture? What's best about the culture? What parts would you like to change and why? Identify some other leaders inside or outside the organization that you feel make a positive contribution to culture. What specifically do they do, and why is this important? In what circumstances does your preferred leadership style, from the Leadership Styles Inventory, make a positive contribution to your organization's culture? In what circumstances is it less effective? What might you do to become more comfortable using other leadership styles? And here are some things you might consider doing before you move on to the next module. If you haven't already, complete the Leadership Styles Inventory and hang on to your results. We'll refer to this periodically throughout the series. And if you're completing this series with colleagues, share your results with them. Learn more about the transition to value and population health by watching these videos. The Rural Hospital Care Coordination and Population Health Management Summit video. You'll hear from rural healthcare experts as they identify key initiatives that leaders and providers should take to further develop a local infrastructure to best deliver and manage population health in the future. The Cleveland Clinic Population Health video is a 4-minute video that explains population health in an easy-to-understand way. Set up a time to talk to your manager about things like your organization's approach to the transition to value payment models. Has the organization made steps toward a shift to value-based care? If so, what has been done and what's coming next? And how can your team contribute to upcoming changes? And your manager's priorities. What does their manager expect from them? What are the biggest challenges they're working to address, and how can you best support their work? Reach out to one person whose job you'd like to know more about. Ask them to help you understand their priorities and challenges. Find out what you can do to support them, and if they ask how they can support you, feel free to share. Identify a decision or change you need to make that might impact patient care or a medical provider's work. Schedule some time with a provider to share any relevant short or long-term goals and ask for their perspective. How would they approach it? What would they consider when making these decisions? Listen carefully, be clear about next steps, and thank them for sharing their perspective. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program by searching for Leadership Fundamentals within the Center's resource library. And of course, please feel free to contact us at the Center anytime for additional support. We thank you for joining us today, and we look forward to continuing the conversation over the next few months.